Good afternoon. My name is Dr. Samrat Shah. I'm working as consultant physician at Apollo Spectra Hospital, Pune. And today we are going to talk about a very important topic, that is life after 50s. And we decided to talk on this topic because it is very important for all of us to know how to lead your life after 50s, so that you have a good lifestyle after the age of 70s. We all know that 70s is the age when we have dependency in life, and life after 70s is not easy. We have muscle weakness, we have body aches, we have reduced strength in the body, walking become difficult. There are so many illnesses that comes in the body after the age of 70. And hence what is important to understand is how importantly and how beautifully and how healthy we lead our life after the age of 50 till the age of 70, so that we have some good life after the age of 70. So we are going to talk about what all things are to be done between the age group of 50 to 70, so that you have your beautiful 70s and life after that. What I truly believe is we all have to die one day, and when the time comes, we should be dying peacefully and not dying in an ICU bed or in the hospital bed with a lot of illnesses around, like diabetes and diabetes related complications in the form of chronic kidney disease and dialysis and angioplasty and bypass and ventilators. That should not be the cause of death. What I feel is we should have a beautiful healthy life even after 70s, and when the time comes, we should have a peaceful death. So we are going to talk about what all things are to be done between your 50s and 70s. There are few important things which we need to know when we have diabetes, when we have hypertension, when we have obesity, when we have lifestyle disorders, and leading your life with all these diseases between the age group of 50 to 70, or any time before the age of 70, so that you have beautiful 70s. So the first thing I'm going to talk about today is about leading your life with diabetes. So if you are diabetic, diagnosed to have diabetes at the age of 30 or 40, remember that when you are going to be 70-year-old, your diabetes is going to be of already 30 to 40 years old. So a diabetes of 30 years is definitely going to have some impact on your lifestyle, some impact on your health. We know that diabetes causes many complications, like diabetes is associated with heart diseases, it is associated with cholesterol, it is associated with strokes, it is associated with kidney failures, it is associated with damages to your peripheral nerves causing foot ulcers and foot amputations. It is associated with diabetic retinopathy, wherein we develop permanent blindness. And remember, all these illnesses related to diabetes are silent disorders. They don't come with any symptoms. So what is important is you cannot wait till you get the symptoms related to complications of diabetes. Like diabetes, you don't understand the sugars unless you do the blood test. So if your sugar is 120 or it is 300, you only get to know when you do a blood test. In the similar manner, you will not get to know any complications related to diabetes unless you do a health check. So according to ADA, it is important that at least once in a year you do a preventive health check on all the diabetes related complications when you're diagnosed to have diabetes. It is important to undergo fundoscopy at least once in a year. Fundoscopy is a test for checking your retina, because diabetic retinopathy is a leading cause of diabetes related blindness. So that is very important to check once in a year. Apart from that, make sure that at least once in a year you have a routine executive health checkup, which includes your testing on kidneys, a monofilament test or diabetic neuropathy testing. You should always test your cholesterol levels, your status of your liver, and the status of your heart at least once in a year. These things are important because diabetes always comes with a list of complications. So always remember to do once in a year diabetic health checkup. Apart from that, make sure that your sugars are aggressively controlled, whether it is diabetes or it is uh, diabetes related complications. You should always check on these things. अपार्ट फ्रॉम दिस, डायबिटीज में बहुत सारे अलग कॉम्प्लिकेशंस भी आते हैं, जैसे डायबिटीज की वजह से नेफल नाम का एक डिसीज होता है या लिवर डिसीज होता है, जिसमें डायबिटीज की वजह से लिवर में सूजन आता है, और ये डायबिटीज रिलेटेड कॉम्प्लिकेशन यूजुअली इट कम्स इन एसोसिएशन विद ओबेसिटी. डायबिटीज और ओबेसिटी दोनों हाथ में चलते हैं. सो ओबेसिटी को कंट्रोल करना बहुत ज़रूरी है, क्योंकि बिना ओबेसिटी के कंट्रोल किए डायबिटीज या हाइपरटेंशन या डायबिटीज रिलेटेड कॉम्प्लिकेशंस को कंट्रोल नहीं कर सकते. So always remember, weight loss is an important target while treating diabetes, because the more you lose your weight, the more is your diabetes coming in control, more is your liver fat coming in control, more is your blood pressure coming in control, and also more is your hypertension coming in control. So these are the basic things which you should know about diabetes. If we talk about hypertension and managing your lifestyle, every hypertensive patient should remember that salt cutoff is the gold mine. So हमेशा याद रखिए, जितना नमक आप कम खाओगे उतना ब्लड प्रेशर कंट्रोल में रहेगा. उसके अलावा लूजिंग वेट इज ऑल्सो इम्पॉर्टेंट. 1 kg वेट लॉस से एटलीस्ट 2 mm ब्लड प्रेशर कम होता है. सो इफ यू लूज वेट बाय 10 kg, आपका ब्लड प्रेशर 20 mm से तो कम हो जाएगा. So instead of depending on medications and increasing the dose of medications, it is important कि आप लोग weight loss और lifestyle के ऊपर changes के ऊपर focus करें, and focus more on healthy diet in patients who have hypertension. Low salt is a very important thing to be remembered in patients who have hypertension. Apart from this, if we talk about other lifestyle diseases, सबसे ज़रूरी चीज़ होती है mental peace. Because if you are mentally peaceful between the age of 50 to 70, you are less likely to develop mental complications after the age of 70. So उसके लिए क्या करना ज़रूरी है? The first thing is always make sure that every day you read something. या तो न्यूज़पेपर पढ़े, या तो नॉवेल्स पढ़े, या तो बुक्स पढ़े. बिकॉज 50s के बाद वाला लाइफ, इट इज़ ऑलवेज अबाउट रिटायरमेंट. So make sure that at least 40 minutes every day you read one book, whichever you like, or you read a novel, or you read a newspaper, which is very easy to find. And every day make sure that when you sleep, रोज रात को लिखा करे कि आपने दिन भर में क्या किया था. Writing down what you have done during the day helps you to increase your vocabulary, also helps you to keep your brain active. So these two important exercises are always to be done. Apart from that, if you like games, please play those games which use your brain. Even playing sequence every day will help you to keep your brain active. You can also play Scrabble. You can also play any kind of puzzle games at least for 5 minutes every day to make sure that your brain is active. याद रखें, अल्जाइमर्स डिसीज इज अ डिसीज जहाँ पे डिमेंशिया होता है, and this is very common in Indian females because Indian females are more into their household works and their brains are not usually active in calculations or any kind of active work. So इसीलिए females, especially Indian females, should always make sure कि आप लोग every day पढ़ाई करें, या तो रीड करें किसी बुक्स को या नॉवेल्स को, या फिर रोज रात को लिखा करें कि क्या दिन भर में किया था. Or else you can also go for simple calculations every day. Accounting also helps you a lot to keep your brain active. बहुत सारी स्टडीज ने ये प्रूव किया है कि अगर आप अकाउंटिंग करते हैं, अपने ब्रेन को एक्टिव रखते हैं, कैलकुलेशंस रोज करते हैं, तो आपके स्किल्स लॉन्ग टर्म रहते हैं और अल्जाइमर्स होने के चांसेस बहुत कम हो जाते हैं. So Alzheimer's chances reduces when your brain is active every day between the age group of 50 to 70. So make sure that your brain is always active between the age group of 5 to 50 to 70. Very important task to remember. Apart from that, mental health is also important. Mental health में ये चीज करना जरूरी है कि peace of mind होना जरूरी है. So if you have any kind of stress, if you have any kind of anxiety disorders, please get these things checked and get these things treated, because treating lifestyle disorders in the form of anxiety and depression at an early stage always helps to have a good mental peace after the age of 70s. आफ्टर द एज ऑफ 70s डिपेंडेंसी आती है, जिसकी वजह से लोगों से बात करना या टॉकिंग टू पीपल और कम्युनिकेटिंग इन द सोसाइटी कम हो जाता है, जिसकी वजह से डिप्रेशन के चांसेस और बढ़ जाते हैं. इसीलिए 50s टू 70s के ग्रुप में बीच में अपने अपने फ्रेंड्स का ग्रुप बनाएं, अपने अपने लेडीज के ग्रुप बनाएं, एंड प्लीज मेक श्योर दैट यू मीट एवरी डे एंड डिस्कस अबाउट योर इश्यूज. Discussing with your friends and family helps you to reduce the stress. That is very important aspect for a mental peace. Apart from that, every day in the evening after your dinner, walking around for 15 to 20 minutes without having any discussion about your lifestyle or family helps you to get a mental peace before you go to bed. So please make sure that you follow these basic rules about mental health and mental peace, and always involve yourself in one thing which you like in life. If you like to play table tennis, please make sure that you play table tennis. If you like to play badminton or any kind of outdoor activities or indoor activities, एनीथिंग विच यू लाइक। दिन में एटलीस्ट 20 मिनट्स के लिए वो चीज़ करना जो आपको पसंद है बहुत ज़्यादा ज़रूरी होता है। सो एटलीस्ट फॉर 20 मिनट्स every day, make sure that you do one activity which you like for yourself. So this helps you to bring mental peace every day. और जब भी आपको एंजाइटी अटैक आए या पैनिक अटैक आए या डिप्रेशन जैसी चीज़ें आए, सो प्लीज़ मेक श्योर दैट यू गेट आउट ऑफ दैट प्लेस और दैट सराउंडिंग्स एंड गो इनटू अ डिफरेंट एनवायरनमेंट। अगर आप घर पे हैं और घर पे इन चीज़ों का स्ट्रेस हो रहा है, तो गो आउट फॉर अ वॉक, स्टार्ट लिसनिंग टू योर म्यूजिक and start walking on the streets. This also helps. So important thing is to change the surroundings which gives you stress. This is very important aspect for mental peace. So always make sure that mental peace is maintained. So apart from mental peace, maintaining physical strength is also very important after the age of 70s. So in order to achieve that, what you can do is start wearing shoes every day after your life in 50s. So wearing shoes after 50s helps you to maintain good posture balance after the age of 70s. So if you start wearing shoes from now, your muscles will not lose your strength. And the most important reason why people die after the age of 70s, and the reason common being behind that, is fall. So if you fall down somewhere, you have a fracture, and this lands up with complications, and that's why most of the people have death or complications related to fall after the age of 70s, क्योंकि इसमें मसल स्ट्रेंथ कम हो जाता है और स्टेबिलिटी कम हो जाती है। स्टेबिलिटी मेंटेन करने के लिए या फिर लाइफ के मसल्स को स्ट्रेंथ मेंटेन करने के लिए 50s के बाद स्नीकर्स का यूज करना जरूरी है। जितना हो सकता है उतना अपने मसल्स को यूज करें, बिकॉज इफ यू डोंट यूज योर मसल्स यू लूज देम। सो इन ऑर्डर टू नॉट टू लूज द मसल स्ट्रेंथ, रोज 20 मिनट्स का रनिंग करना जरूरी है। अगर आप रन नहीं कर सकते तो एटलीस्ट वॉकिंग करना जरूरी है। रोज एटलीस्ट 20 मिनट्स एवरी डे इन द मॉर्निंग, वॉकिंग, रनिंग, साइकिलिंग, स्किपिंग या स्विमिंग, इनमें से कोई भी एक्सरसाइज जो आपको पसंद है इसमें से करना जरूरी है। अगर आप वॉकिंग करना चाहते हैं तो ब्रिस्क वॉकिंग या फास्ट वॉकिंग करना जरूरी है। अर्ली इन द मॉर्निंग 20 मिनट स्लो वॉक यूजफुल नहीं होता है। सो ऑलवेज मेक श्योर कि आप अर्ली मॉर्निंग ब्रिस्क वॉक करें या फास्ट वॉक करें। इवनिंग टाइम पे जब आप वॉक करते हैं आफ्टर योर डिनर, प्लीज मेक श्योर दैट वो स्लो वॉक हो। इट इज मेनली फॉर योर मेंटल पीस। अर्ली मॉर्निंग वॉक इज नॉट फॉर योर मेंटल पीस बट इट इज फॉर योर गुड स्ट्रेंथ इन मसल्स। अपने मसल्स और अपने जॉइंट्स का स्ट्रेंथ बनाए रखने के लिए ये एक्सरसाइजेस रोज करना जरूरी है। अगर आप रोज एक्सरसाइज नहीं करना चाहते हैं तो हफ्ते में 2 दिन का ब्रेक ले सकते हैं, जिसमें एक ब्रेक बीच में आएगा वीक के और एक वीक के एंड में आएगा। अगर आप ये सोचेंगे कि सैटरडे और संडे ब्रेक लेंगे तो वो नहीं चलता है। एटलीस्ट वीक में एक डे जैसे वेडनेसडे या थर्सडे ब्रेक ले और संडे ब्रेक ले तो चलता है। बट 5 days a week, at least 20 minutes of one of these 5 exercises is very important. रनिंग, साइकिलिंग, स्किपिंग, जॉगिंग और स्विमिंग, इन पांचों में से कोई भी एक एक्सरसाइजेस एवरी डे 20 मिनट्स के लिए करना जरूरी है। सो दिस इज अबाउट फिजिकल हेल्थ। अगर आपको बैलेंसिंग सीखना है तो अभी से बैलेंसिंग सीखना स्टार्ट करें, बिकॉज आफ्टर 70s बैलेंसिंग इज द फर्स्ट थिंग टू बी अफेक्टेड। सो इन ऑर्डर टू मेंटेन बैलेंसिंग और स्ट्रेंथ इन द मसल्स, इन ऑर्डर टू मेंटेन द गुड पोस्चर, अभी से पोस्चर के ऊपर भी ध्यान दें। जैसे अगर आप चेयर पर बैठ रहे हैं तो मोस्ट ऑफ द टाइम स्ट्रेट बैठना जरूरी है। अगर आपका लॉन्ग टर्म सिटिंग होता है तो आफ्टर एवरी 30 मिनट्स मेक श्योर कि आप एक 5 मिनट के लिए तो एटलीस्ट घर के अंदर ही सही, लेकिन आप वॉक किया करें। So walking for 5 minutes after every 30 minutes of long-term sitting is very important to maintain this muscle strength. So this is all about muscle strength. We have spoken about mental health. Apart from these things, maintaining your diet is very important. So diet में क्या चीजें करना जरूरी है? After the age of 50s, जितना हो सके उतना जंक फूड्स को क्विट करें। Junk foods are not good for any health, but if you are in your 50s and waiting to reach your 70s, so at least make sure that आप junk food बंद करें। In your diet, फाइबर कंटेंट बढ़ाना जरूरी है, बिकॉज कॉन्स्टिपेशन का प्रॉब्लम 70s के बाद यूजुअली सबको होता है। सो इन ऑर्डर टू अवॉइड गेटिंग कॉन्स्टिपेशन रिलेटेड इश्यूज, स्टार्ट गोइंग फॉर फाइबर रिलेटेड डाइट। फाइबर डाइट में क्या होता है, एक तो पानी रोज का ज्यादा पीना होता है, दूसरी चीज होती है फाइबर कंटेनिंग फूड प्रोडक्ट्स को बढ़ाना। जैसे नट्स खा सकते हैं, कैश्यूज खा सकते हैं, सोयाबीन खा सकते हैं। यू कैन टेक मोर एंड मोर अमाउंट ऑफ स्प्राउट्स। आप बनानास खा सकते हैं, पपाया खा सकते हैं, चिक पीस खा सकते हैं और प्रोटीन कंटेंट बढ़ा सकते हैं। इन चीज़ों को डाइट में बढ़ाने से और पानी का कंटेंट पानी शरीर में बढ़ाने से फाइबर कंटेंट बढ़ता है जिसकी वजह से स्टूल सॉफ्ट होते हैं. So in order to avoid constipation related issues, please increase the fiber diet in your diet. फाइबर्स को बढ़ाना बहुत ज़रूरी है. अपार्ट फ्रॉम दिस, मेक श्योर दैट यू डिपेंड मोर ऑन जवार फ्लोर rather than wheat flour. Rice is not good for your health. As much as possible avoid intake of rice, मैदा और गेहूँ, इन चीज़ों का यूज़ करना कम करें. Rice, potatoes, मैदा and wheat flour are not good for your health. As much as possible avoid these things. You should increase the content of vegetables, fruits and salads in your diet. जितना हो सकता है इन चीज़ों पे डिपेंड करें. टेकिंग मिल्क एवरी डे इज वेरी गुड फॉर योर हेल्थ because milk increases the strength in your bones, and after the age of 70s osteoporosis is very well known factor. So please make sure that you take milk every day. At least one glass of milk every day with little bit of protein powder is good for your health after your 50s, so that you have good muscle strength as well as good bone strength. Please follow these basic diet instructions and avoid depending on outside food. When you're having your food, make sure that your dinner is finished by 7:30, because old age may after 70s gaseous distension, abdominal discomfort, nausea, vomiting, acidity जैसी तकलीफें ज़्यादा हो जाती है. So in order to prevent these things, start changing your lifestyle from now, because इसमें having your dinner at 7 o'clock in the evening is very important, because gastric peristalsis slowly उम्र के हिसाब से कम होता है. सो इन ऑर्डर, अगर आप खाना रात का लेट खाते हैं, जैसे 9 बजे अगर आप डिनर करते हैं, तो आपका डिनर डाइजेस्ट होने के लिए कम से कम 4 घंटे लगेंगे जब आप ऑलरेडी सो रहे होंगे. सो जब आप सोते हैं तो गैस्ट्रिक पेरिस्टाल्सिस कम होता है, फूड एब्जॉर्ब नहीं होता है, फूड स्टमक के अंदर रहता है, और फ्लैट लेटने की वजह से रिफ्लक्स होता है जिसमें इसोफेजियल इरिटेशन होता है, चेस्ट चोकिंग फीलिंग आता है, नोजिया वाला फीलिंग आता है. इसीलिए इन ऑर्डर टू अवॉइड दीज थिंग्स, please make sure that you finish your dinner by 7 in the evening, so that you have enough ample of time to have your food digested, to have your gastric peristalsis done rightly. And you can also go for a walk after your dinner. Maybe at 8:30 you can go for a normal walk, casual walk, without having any vigorous exercises, which can only give you a mental peace. So in order to provide in order to avoid gastric troubles, चाय को अवॉइड करना जरूरी है. टी, कॉफी, these things are first things to be avoided. Start quitting your tea and coffee dependency as soon as possible, because they increase the incidences of gastric troubles. In order to avoid gastric acidity issues, please start quitting tea and coffee. Alcohol, smoking, or any kind of social habits are not good for your health. You should quit them if you're already dependent on them. This is the right time to quit, because all these things are going to add up on your health burden after the age of 70s, and they are going to make your life terrible after the age of 70s. So in order to have a good lifestyle after the age of 70s, you need to start bringing change in your diet. You need to start bringing change in your lifestyle from today. If you don't do these changes from today, you're going to have a difficult life after the age of 70s. Because remember, any of these disorders, be diabetes, hypertension, obesity, joint pains, joint distractions, osteoarthritis, none of these disorders cause any kind of complications early in their 50s. इन सबके complications 70s के बाद में ही दिखाई देते हैं most of the times. So in order to prevent getting these things, change your lifestyle from your 50s to have a beautiful 70s, and few basic changes in your lifestyle can you have a good lifestyle after the age of 70s. Remember, 70s is the time when we are dependent on people, and that is the point when you start getting these health issues. So in order to avoid getting these things, in order to have a dependency life, if you want to have an independent lifestyle, if you want to avoid having dependency on others, you need to change your lifestyle from today, so that you have a good and beautiful 70s. Life is very short, life is very precious. If you want to have a healthy lifestyle, if you want to have a beautiful life and beautiful death, you need to change your lifestyle from today, because changing healthy life from today is very important. We have all seen during the COVID times, it is terrific to be in ICU. It is terrific to die without having somebody near you. So if you want to have a peaceful life, if you want to have a joyful death when your time comes, please make sure that you follow these basic instructions, where you need to change your lifestyle in the form of diet, you need to change your exercise pattern, you need to have little bit focus on your mental health, you need to have little bit focus on your junk foods. So if you start doing all these things from today, I don't think so you'll have any kind of difficult issues in your 70s and above. So thank you so much for all the listeners for having this good time. I hope this brings a small change in your lifestyle. I hope you this helps you to have a good life after your 70s. If you have any queries further, you can always come back to us and discuss with us about any of your lifestyle related disorders at Apollo Spectra Hospital Pune. Thank you.